Today, we're going to talk about a medication that's been a cornerstone of medicine for decades, methotrexate. It's a real workhorse of a drug, but it also leads this kind of fascinating double life, treating two completely different kinds of conditions. And that really brings us to the big question, right? How in the world can one single drug be a heavy-hitting chemotherapy agent and the go-to treatment for calming down an overactive immune system, like in rheumatoid arthritis? It sounds like a total paradox, but the answer is hiding in how it works at the cellular level. So, here's how we're going to break it all down. We'll start with what this drug is actually doing inside your body. Then, and this is super important, we'll get into the critical difference in dosing. After that, we'll look at the side effects and how doctors manage them. And finally, we'll wrap up with the different ways you can take it. All right, first up, let's pop the hood. We're going to get into the science of how methotrexate actually does its job. At its very core, you can think of methotrexate as a cell blocker. Its main job is to target cells that are dividing and multiplying super fast. Now think about that. What kinds of cells do that? Well, cancer cells, obviously, but also our own healthy cells in places like our bone marrow or the lining of our mouth and gut. And that little detail is going to be really important later on. Okay, so how does it actually slam on the brakes? Imagine a cell is like a busy construction site trying to build new cells. To do that, it needs blueprints. That's the DNA. And there's this one specific enzyme, kind of like the site formin, called dihydrofolic acid reductase, whose only job is to hand out those blueprints, while methotrexate comes in, finds that formin, and basically blocks him from doing his job. No blueprints get handed out, and construction just grinds to a halt. Cell division stops. Simple as that. But here's where things get really interesting. That whole blueprint blocking thing, it perfectly explains how it fights cancer. But for rheumatoid arthritis, well, scientists aren't 100% sure how it works its magic on inflammation. The best theory we have is that at those super low doses used for arthritis, it has a much more subtle effect. It kind of persuades the overactive immune cells to just chill out. But the exact how is still a bit of a scientific mystery. And that brings us to maybe the single most important thing to understand about this drug, the dose. Getting this distinction is absolutely key to understanding everything about methotrexate. So, what is it officially used for? Well, the FDA has given it the green light for some pretty serious conditions. On one side, you've got these aggressive cancers like leukemia and lymphoma. And on the complete other side, you've got these chronic autoimmune diseases like severe psoriasis and rheumatoid arthritis. Two totally different battles. So here's the punchline. It's all about the dose and the schedule. For something like rheumatoid arthritis, a patient might take a really small dose, say 15 or 20 milligrams, just once a week. But for cancer, whoa, the doses can be hundreds, sometimes even thousands of times higher, and given way more often. This difference is everything. It's what makes the drug a manageable long-term therapy for one person and an aggressive short-term treatment for someone else. Now, of course, a drug this powerful is going to have some potential downsides. So let's talk about the risks and side effects, and more importantly, how doctors are so good at managing them. One of the most common things people report is nausea. As you can see here, somewhere between, say, 10 and 19% of people experience it. So for every 10 people taking it, 1 or 2 might have to deal with that queasy feeling, especially the day after their weekly dose. And it's not just nausea. People might also feel pretty tired, get some annoying mouth sores, or see a temporary spike in their liver enzymes on a blood test. These are all signs that the drug is doing its job, affecting those rapidly dividing cells we talked about earlier. Now, we do have to talk about the more serious stuff. It's not as common, thankfully, but it's super important to know about. Because it slows down cell production, it can suppress the bone marrow, leading to low blood counts. It can also cause more significant issues with the liver or even the lungs. This is exactly why anyone on this drug is monitored so closely. And this right here is the single most important safety warning I want to be absolutely crystal clear. Because this drug's entire job is to stop cell division, it is extremely dangerous to a developing fetus. It must be avoided, no exceptions, by anyone who is pregnant or even thinking about becoming pregnant. So you might be thinking, wow, with all those risks, how can it be used safely? Well, doctors have a really smart playbook. First, regular blood tests are non-negotiable. They're looking for any early signs of trouble with the liver or bone marrow. Second, almost everyone on it also takes a folic acid supplement. This is a game changer. It helps protect the healthy cells and can seriously cut down on side effects like nausea and mouth sores. And third, it's all about fine-tuning. Doctors are constantly adjusting the dose to get the best possible effect with the fewest side effects. All right, for our final section, let's get practical. Let's talk about how you actually take the medication, because it's not just one size fits all. This table lays it out perfectly. For patients with conditions like arthritis, the most common ways to take it are either as a simple pill or as an easy under-the-skin injection you can do right at home. That high-dose IV form you see at the bottom, that's almost exclusively used in hospitals by oncologists for cancer treatment. So why would a doctor switch someone from a pill to an injection? Well, it usually comes down to two big reasons. First, absorption. The body just absorbs the injected version more reliably and completely, which can make it work better. And second, side effects. Because the injection bypasses your stomach, it often causes way less nausea. For a lot of people, making that switch is a total game changer. And that brings us to a final thought to chew on. Methotrexate was first made way back in the 1940s, and it was created to be a cancer drug. Its incredible use for arthritis wasn't discovered until decades later. It just makes you wonder, what other amazing discoveries are hiding in plain sight in medicines we already use every day, just waiting for someone to ask the right question?